Welcome to Diaspora Voices, a podcast brought to you by Kunye Financial, where we empower African diaspora communities to invest, connect, and make a difference back home. From healthcare solutions to financial innovations, we bring you impactful stories, expert insights, and real conversations about shaping a better future for our loved ones and our continent. Today, we're tackling a crucial issue: healthcare challenges in Sub-Saharan Africa, and how the diaspora can play a critical role in creating reliable solutions for our loved ones, our countries, and the continent as a whole. Join us as we explore insights and impactful strategies to empower our communities. Today, we're tackling a crucial issue: healthcare challenges in Sub-Saharan Africa, and how the diaspora can play a critical role in creating reliable solutions for our loved ones, our countries, and the continent as a whole. Join us as we explore insights and impactful strategies to empower our communities.
At Kunye, we believe in empowering diaspora communities to care for their loved ones back home. That's why we've partnered with Diaspora Meds to ensure that their health and well-being is now simpler than ever. Diaspora Meds provides access to quality, affordable medical care for your loved ones in Zimbabwe. With 4 flexible plans to choose from, you'll find an option that fits your family's needs and budget. Their plans offer more than just medication, preventive care to keep your family healthy, access to a nationwide network of over 500 healthcare providers, a bereavement benefit to support your family in difficult times, a cashback plan to help you save, international coverage and protection against Zimbabwean policy changes for added peace of mind. Diaspora Meds is more than just access to medical care, they're family. Click the link below to learn more and give your family the gift of health.
Welcome to today's webinar. We're today discussing empowering global Africans and talking specifically about healthcare innovations for Sub-Saharan Africa. We're excited to have you guys join us today as we dive into this incredible impact we believe that healthcare innovations can have across Sub-Saharan Africa, and to also explore the role that the African diaspora, that means you guys, can play in this journey. So today we're honored to have with us 2 very remarkable individuals. They'll bring their deep expertise and passion for healthcare in Africa into this discussion. So first I have Dr. Richard Oyeifeso, a consultant pediatrician and co-founder of an NGO called For Birth for Life, and also Heart for Nigeria. He's a very busy guy, working across, his regular career and these other initiatives. We'll hear more about them in just a moment. We'll also have with us Ruvimbo Chimuta. She's a legal counsel and co-founder of the Grace and Nelly Project. She's very focused on empowering African women and communities through sustainable healthcare and development initiatives. Her legal and community-based approach brings a unique perspective to her initiatives, and we'll probably get to talk a little bit more about that as well. So together they'll share insights on how innovation and healthcare solutions are transforming lives across Sub-Saharan Africa, and about the impact it can have, and both benefits to you and ways that you can also contribute. Let's start by going the traditional way of saying ladies first. So, Ruvimbo, would you be able to just give the audience a brief introduction of yourself and your background, and of course, maybe a little bit about the Grace and Nelly Project?
Thank you so much, Ladi. That was such a lovely introduction. So as Ladi said, I am the founder of the Grace and Nelly Project. I call it my baby. I was born in Zimbabwe, bred in Zimbabwe, lived there for 19 years of my life. And like many of us, moved to Canada to seek a better life, basically. when I came to Canada, I always told myself I was going to go back home, but never did. I stayed. And I'm deeply connected to the country, the people, and I love it so much. And I always wanted to give back. I always wanted to do something that, even though I'm here, I could still do something back home for the people back home. So the Grace and Ellie Project started in 2016. It was really small. It's still small, but I believe we make a huge impact. And what we do is we provide reusable menstrual pads to girls in school. So both primary school and high school. And as you can see behind me, menstrual rights are human rights. And I have that up there because I think it's super important, because as we talk about health, I believe that health is a human right. And so are menstrual rights, because they are integrally tied to one's health, one's well-being, one's dignity. So we make sure that girls get their pads, have menstrual pads that they can use throughout the year. We use reusable pads because those are better for you. I believe they're better for you. Better for your body, better for the environment, and we make sure that we supply the girls with reusable pads for a full year. And we've been doing that, as I said, since 2016. And we also help women in teaching them entrepreneurship skills, development skills. So basically how you start and run a business, how you market a business. Those are the things that the Grace and Ellie Project has been doing over the last few years.
Thank you for that intro. I think it's given an audience insights into the directions that this conversation can go, especially around innovation and healthcare in Africa. Let me now turn to Dr. Oyefeso.
Yeah, good evening. It's a pleasure to be here, and thank you to the Kunye family for this the opportunity to speak this evening. Yeah, my name is Richard Olumide Oyefeso. I'm a pediatrician, trained in the U.S. and now live and practice in Canada. I previously practiced in the Caribbean as well after my journey started leaving Nigeria. So I'm the founder of an organization called For Bread for Life. And what we do is to address health disparities in our own humble way. Nigeria has the second highest infant and maternal mortality rate in the world. I tell folks that depending on the resource you look at, on average, more than 1,000 babies die in Nigeria every day, of which many of those deaths are preventable. At For Bread for Life, our mantra is every life matters. Unfortunately, many of these deaths are preventable. And at the core of it, what we do is we train healthcare providers on basic resuscitation skills. We train them on best practices in order to improve their skill sets and also to raise the standard of care. We've trained thousands of providers across the country and still ongoing. We run medical clinics as well to help the vulnerable. We support orphanages, and part of what we do is also a unique intervention that we call Heart for Nigeria, whereby we partner with organizations, partner with heart surgery teams in order to provide critical cardiac surgery to vulnerable children. These projects are near and dear to our hearts, and that's what we've been doing now for over 15 years. And we still have so much more to do, and we're hopeful that we will have the opportunity to be able to do more, to expand our reach, to grow more connections and partnerships so we can save more lives. Thank you for having me.
So I would like to dig into your experiences and your understanding of healthcare innovation and how it can improve things on the continent, solve problems that people have. And in essence, I'd just like to give a brief sort of idea around how we see innovation. For me, I see it as a way of commercializing or spreading ideas through teams and people. I see it as a way of using resources that you have in your hand in new ways, or to solve new problems that might already have been existing, right? And so when we apply that to healthcare, an area in which there are numerous problems, especially across the continent, it'll be very interesting for us to explore how that applies to our lives, how we can take advantage of it, or how we can use healthcare innovation to improve things for ourselves or our loved ones across the continent. So I'll start off by asking questions, and after some time, I believe we'll be able to give the audience an opportunity to also ask a few questions as well. Again, I'll go ladies first, and I'll start with you, Ruvimbo, if you don't mind. So Ruvimbo, in your experience, what are some of the most pressing healthcare challenges that could benefit from innovative solutions, particularly in developing regions in Zimbabwe? Let's start with that.
Okay, so I will again talk about menstrual rights. So one of the things when we talk about access to, menstrual products or access to anything related to a woman's body, one of the key difficulties we find is access to information, access to resources. So, just the amount of money you need in order to purchase these pads, right? So we find that the young girls we work with in the community, as well as the women we work with in the community, do not have the funds in order to purchase the products that they need. And one of the issues we find is that the products that are there for them that might be affordable are not products that are actually helping. So if you've ever been to Zimbabwe, or if you've ever been to a low-income country and you purchase a pack in Zimbabwe, it was like $1.50 for a pack of pads. You'd get about 5 or 10 pads in that packet, and they're not particularly good pads. They are pads that are not super absorbent. They mostly just have cotton in them. So it's not a good product, but that's the product you can afford. And that's if you're lucky. For a lot of young women and young girls, we've read stories where they're using dung, they're using sand, they're using old rags, all things that are unhygienic and they're unhealthy. They're not good for your body. And even in terms of, from a standpoint of dignity, it's not something that you're not feeling comfortable about yourself or confident in yourself. So the way we sought to innovate and deal with the issue was, as I said, we use reusable menstrual pads, and the reusable menstrual pads that we provide to these girls in the communities we work with, these are locally sourced. So they are manufactured within the community. One of the things we've actually done is taught women and girls to make these reusable menstrual pads. So for us, it's a very simple, innovative way to help women and girls deal with something that we see as a health issue. We see it as an issue that is tied to poverty as well, right? So one of the things we do is when we work with the young girls, we're providing these pads for free. So we've taught you how to make pads, we purchase them for you, we're teaching you how to make them, but we're always making sure that if you're in high school, if you're in primary school, even if you have access to the clinic, we make sure that the clinic has access to the pads that we have. So making sure we're getting to as many people as we can. But then we have the women. Now, as an organization, we cannot afford to purchase pads for everybody, including the women. So one of the things we did is in 2020, we started what we call Healthier, Happier Periods, which is a part of our organization that makes and sells reusable pads here in Canada. And the idea is that all the money that we make from the from the sale of the pads here is going to subsidize the sale of the pads that we're making back home. Now, I have to say, this is a future dream of ours that we're working on. We've purchased sewing machines, we've trained the women how to sew, and our hope is that we continue to do this. And that for us is, it's not necessarily a medical intervention, but it is an intervention from an entrepreneurship standpoint. It's an intervention from, the not-for-profit world, where we are doing our bit to make sure that these young girls and these women have access to these products. And I'll also say that part of our innovation is we also want to make sure that these women can actually afford not only to purchase our products, but to purchase any product that they need. So this is why we've taught them how to start and run a business, because we're trying to help them get on their feet. So as I said, part of the issue is that it's a poverty issue, right? So for capacity building, we're giving you the tools that you need in order to access the information you need, in order to access the products you need to better your health.
Fantastic. I think, like I said previously, innovation is basically using what you already have to solve new problems in novel ways, or solving old problems in new ways. And this certainly falls into the solving old problems in new ways category. Dr. Oyefeso, can you share some of the specific examples of innovative healthcare solutions or interventions that your organization, that's for Birth for Life and Heart for Nigeria, have implemented, and what inspired the development of these innovative solutions?
Yeah, thank you for the question, and also kudos to Rubimba and her team for the work that they're doing. I think it's such an important thing that we address this kind of nagging, persistent, real-life issue that women experience all over the world, on a monthly basis. So it's really a noble effort that you guys are putting forward to address that issue. For Birth for Life, so as I mentioned, we're addressing birth asphyxia. Birth asphyxia essentially is a situation where a child is born and a child is not breathing at the time of birth, as simple as that. And how I explain to people, a baby doesn't breathe when it's inside the mom because the baby gets its oxygen source, because the reason why we breathe is because our body requires oxygen converted into a fuel, for our cells, through the interplay of the connection between our hearts, lungs, and breathing apparatus. But a newborn baby, a baby that's inside the mother's womb doesn't need to do that because of the umbilical cord and the placenta. So the placenta gets this, what we call oxygenated blood, delivers the oxygenated blood through the cord to the baby. So the baby doesn't have any need to breathe. But when the baby is born, after the baby is born and the umbilical cord is severed, the baby now has to initiate breathing for itself. But somewhere along the line, many times the baby is unable to initiate that spontaneously. And that baby now requires assistance to breathe. So we dry the baby, we stimulate the baby, and many babies would breathe based on that simple intervention. But there are many more babies who require more support for them to breathe. In that situation, the healthcare provider needs to use what we call an ambu bag. And they will use that ambu bag in order to push air into the baby's lungs, and the baby starts breathing. It's as simple as it sounds, but unfortunately, there are many places in sub-Saharan Africa, also case in point in Nigeria, where this is not happening because the healthcare provider is not well trained enough. Neither is the provider skilled enough. So ultimately, the goal is that there should be a skilled birth attendant present at the birth of every baby. So that's on the policy level. So one of the things that we try to push on the policy level is that the powers that be, the stakeholders, the government, ministries, and other health agencies, that we should strive to make it possible that a skilled provider is present at every birth. So, but due to the presence of that gap, so more than 15 years ago, I started to churn on the idea of how we can address this problem. And I came across a program that's called Helping Babies Breathe. And it's a very uniquely designed program. And the simple target is to run healthcare providers through the process of helping a baby breathe. So not only do we help the baby, train the healthcare providers to help them breathe, but we also strive to provide the equipment that they require in order to do the work. So if you imagine a place like Nigeria, we have a population in excess of 200 million people across about 36 states, and we also have many rural areas. So what we decided to do was to study the whole map and identify places where interventions are required. Then we build partnerships with providers in those areas. We build partnerships with them, and then we're now going to train to train the providers on these skills in different groups. And then we try to put some systems in place to keep in touch with them and to further push the agenda. And we maintain contact with them so that they can maintain their allegiance, for lack of a better word, to the rudiments of the training, so that wherever they are working, they can save the life of a newborn baby. But the multiple challenges along the road. So part of what we actively do is really build an army of volunteers and supporters for the work that we do. It's not easy, but it's actually the best way to do. So based on our efforts, we have partnerships across the country. We have previously we used to do all of the work ourselves, identify an area, come in boots on ground, train the people. But we trained the people over the course of the year. But it was always a challenge because there's a lot of machinery we have to put in place for that to happen. So fortunately, we're now able to pivot on that. So what we're doing is that we're now connecting with local pediatricians who are connected to local teaching hospitals, and we now build a relationship with them so we can facilitate training with them, either in person when we're on ground, but also more importantly, we're able to maintain the connection so that all year round, trainings can happen in several parts of the country. In addition, I'll quickly add that we also started running medical clinics because there are just so many people who don't have access to basic healthcare. Basic healthcare is a fundamental human right. And, one of the things that is so important to us is that we actually wrap all of the things we do around the concept of dignity. It's actually dignity. It is basic human dignity that everybody deserves. No child should die on their birthday. Every human being should have access to basic fundamental healthcare. Interestingly, I know we have many shiny and interesting new medical interventions, but interestingly, most people only require basic primary healthcare. The majority of us don't require the more sophisticated interventions. So at the core of it is that we believe that every life matters. We believe that it is wrong for people to drive preventable deaths. And we believe that there are so many low-hanging fruits that are all around us that we have to propagate in order to continue to sustain life.
At Kunye, we believe in empowering diaspora communities to care for their loved ones back home. That's why we've partnered with Diaspora Meds to ensure that their health and well-being is now simpler than ever. Diaspora Meds provides access to quality, affordable medical care for your loved ones in Zimbabwe. With 4 flexible plans to choose from, you'll find an option that fits your family's needs and budget. Their plans offer more than just medication, preventive care, to keep your family healthy. Access to a nationwide network of over 500 healthcare providers. A bereavement benefit to support your family in difficult times. A cashback plan to help you save. International coverage and protection against Zimbabwean policy changes for added peace of mind. Diaspora Meds is more than just access to medical care. They're family. Click the link below to learn more and give your family the gift of health.
Fantastic. I couldn't help but notice the component there where you spoke about an army of people, and just relating that to what I had said previously around innovation, which is kind of commercializing or spreading solutions or ideas through teams and people. The people component in innovation is very big, but it's very important. So it was really good to hear that aspect of it with for Bread for Life and the interventions that you carry out. Let me swing back to Uvimbo. I'd like to maybe make this a bit of a compound question. So bear with me, and I'll nudge you to make sure that both aspects of it you speak to. But how would you say, or what would you say are some of the common barriers or obstacles that prevent effective healthcare innovation from being scaled? Kind of looking at your own experience, and making these types of solutions adopted more widely. And how do you think these barriers can be addressed? I'd like to, the second component that I want to put in that is also speaking to design, because a big part of innovation is being able to recognize the challenge and design the solution for that challenge. Like we said, solving old problems in new ways with the resources in your hands. So those two aspects, what are the barriers you see? How can they be addressed? And how do you incorporate design into solving these problems?
I would put the barriers into two camps. So they're the barriers that we face internally as an organization, then they're the barriers that we tend to face externally. So I'll start talking about the external barriers, because I think these are ones that tend to be fairly common. But I talked a bit before about information, so access to information. One of the things that for us as an organization that we started with was educating people about menstrual rights and menstrual health, and the importance of educating these young girls and educating women about their bodies and access to these products. And we are very lucky that, so we work with a community of about 13 villages, and each village has a headman. And I would like to emphasize head man. There's never a head woman. So one of the things that we had to deal with was obviously what, are people going to be comfortable with us talking to their children about menstrual health, right? Because when we talk of menstrual health, we are often talking about reproductive health. And when we talk about reproductive health, we often find that there are barriers to that communication, whether you're talking about traditionally or even people who tend to have conservative values. So we work in rural communities. So you can imagine that the people we tend to work with, the young girls, the women, and the head men tend to hold very conservative values. So one of the first things we had to do was educate the head men as well as the women, as well as the girls, about the importance of the young girls having access to these products. And I'm glad to say that we've experienced very little pushback from the community leaders, from the stakeholders in terms of what we're doing. But we had to make sure that we went through that. So we worked through the school, we worked through the teachers, we make sure, talking about that community of volunteers and people is making sure that you get buy-in from the top in order to actually do what you need to do, right? The young girls we work with and the women we work with are the last people we talked to when we were implementing the product. And when I say the last people we talk to, they're the last people to actually have access to the final product. And then when we talk about internal barriers on these capacity, so anyone who's ever been part of a not-for-profit or ever volunteered or started one, you will understand that not-for-profit world is very much it's very fueled by passion. It is not fueled by money. It is not fueled by time. It is fueled by passion. And so if you're a small organization, you might find yourself, as we found ourselves, operating far higher than we were able to meet in terms of the manpower that we had. So this is a barrier that I say comes from you internally as an organization. And touching on this, I'll just talk about the fact that for a lot of us in the diaspora, we are implementing innovations all the way back on the African continent. And so we are living lives here. You have jobs, you have 2 jobs, you have many things that you're doing, but you're implementing something in a completely different country on another part of the continent. So the barriers there are basically just something as simple as time difference can be a huge barrier, right? It's really simple. You don't think about it, but when you're on the phone at 5 a.m. in the morning, because that's the time that the community that you're working with is up. That's their morning, that's their afternoon. Anyway, so I bring these up because I think that they're barriers that are very much surmountable. They are, at the end of the day, fairly small compared to the work that you're doing. But when you are trying to implement something, these are the challenges that you tend to face. So one of the things in implementing our project was, as I said, we're trying to educate women about not only their bodies, but about the basics of starting and running a business. And when we came up with the project of like, okay, let's teach them the very basics of entrepreneurship. And we had seen so many different NGOs, like large NGOs like the UN, Red Cross, all these organizations are doing so much work in Zimbabwe. And we thought this will be so easy. You will just find somebody in Zimbabwe who has done this work before, and all we have to do is be like, hey, can you come and do a presentation on this particular subject, on entrepreneurship, to the community of women that we work with. And we were surprised to find that very few people who provide these presentations in Zimbabwe provided them in a language that the women understood. The presentations were in English. And I was shocked. I am still shocked. I talk about it and I still don't understand how they're communicating concepts to a country where, yes, English is one of the spoken languages, but not in rural communities. Most of the women we were working with, if they were lucky, had a grade 7 education, or, they'd never been to high school, they'd never finished primary school. And so we needed the presentations, we needed the workshops, the information to be provided to them in a language they understood. And some of the concepts, when people would, we actually went through quite a few different people in terms of interviewing them. They would talk about concepts that they're very North American in nature. These concepts had nothing to do with the African continent. Like, I didn't understand these things when I was in Zimbabwe, and now I'm in Canada. Okay, fine, I know what a moose is, or I know what specific things are, but these are the things we were seeing in those presentations. So we had a hard struggle to find something that was made for Zimbabweans by Zimbabweans. And that's something that is very near and dear to us, and something that when we talk of implementing changes or implementing innovations or designing something, it has to be suitable for the people you're working with. It has to be suitable for the community you're in. So, going right back to the beginning when I was talking about, talking to the headmen and talking to the stakeholders, we had to come to them and talk in a language that they understood. We had to come and talk to them about menstrual health and menstrual rights in a way that they understood, in order for us to have access to the girls in the school, right? So it's the same for the presentations that we were giving the women. They had to be something that they understood. When we were talking about finances, we had to talk about finances in a way they understood. And I think the presenter we finally went with, she used very simple, basic concepts of just like the animals that you find back home on the African continent, giraffes, lions, and it was like, that's the design we try and implement. It's like, yes, things are in the West might sound great and they sound flashy and great, but it has to be something that when you're implementing the innovation, when you're implementing whatever it is that you're doing back home, it has to be something that the person actually understands. Because if they don't understand it, it doesn't matter how great your innovation is or how great the presentation is. At the end of the day, if the person you're talking to doesn't understand it, it doesn't work.